So this Canadian study looked at two immune activators, a PD-1 antibody and a CTLA-4 antibody, durvalumab and tremelimumab. And they used it in a later line setting, colorectal cancer. They were really heavily pretreated, including 25% had regorafenib. It's a randomized phase 2 study, 2-to-1 randomization, a couple of patients with MSI-high cancers, which we know will do well on these immune checkpoint inhibitors. But overall, the study had actually a delta in terms of survival. There was about a 2 months difference in median survival, hazard ratio around 0.75, I think, and so the curve separated. And initially, when you look at first scans, it actually looks like a positive study, which would have been very interesting, considering we are talking about MSS patients. A couple of patients who had one patient had a response, a confirmed response. Now the problem is, the study had a little bit fuzzy statistics. Attenuated alpha, meaning a p-value of less than 0.1 was considered statistically significant. And it's still a small, I think, signal-seeking study. And we don't have any good information about treatments after the intervention. And there are some data that immunotherapy might actually prime tumors toward better response to chemotherapy, actually. In addition, the PFS curves were completely overlapping between best supportive care and this combined immunotherapy. There's actually not a hint of a difference. So overall, I would look at this, this interesting. Would I invest into a phase 3 study with the same combination, the same patient population based on these data? Probably not, to be honest, because I feel a little more hesitant to believe these data, even though I would love to see immunotherapy finally work in MSS cancer. It's just not anything that fits into the overall large pool of data that we've seen so far in this patient population.